Okay, so today we are going to be showing how to give IV medication through a piggyback IV medication. We have Miss Nagel here. She's a 55-year-old patient who is being seen in the ED with abdominal pain, fever, fatigue. She is post-op, 5 days post-op from an open cholecystectomy. She reports pain and increased foul smelling drainage from the incision site. The physician's orders read as Zosyn 3.375 grams every 6 hours to be infused over 4 hours via IV. Volume is 100 mils. The drop factor is 10 drops per mil. We do have to calculate the drops per minute, so that comes out to 4.16 drops per minute. Since we're not able to give 4.16 drops, we will round to 4 drops per minute. Okay, so the first thing that we're going to want to do is prepare the medication outside of the patient's room. We know that we're going to give Zosyn, so we would want to look in our drug guide or whatever resources we have to make sure that it's a compatible medication, and also that our patient isn't allergic. So when we're looking, we need to look at the dose that we're giving and make sure that it is a safe dose. Zosyn is the dose, 3.375 grams is a safe dose. So we will go ahead and pull up the patient's chart in front of us and begin pulling the medication from the Pyxis. You'll check the patient's name, right patient, right route, right dose at the right time. And so I have pulled my medication, and here I will check again. I will look to make sure it has the patient's correct name, the correct dose. You'll also check the expiration date on your medication to make sure that you're not giving an expired medication. And I believe we have everything. So then from here we will go to the patient's room. You want to make sure that your Pyxis is locked and your computer has been shut down to protect, to not have any HIPAA violations. Okay, so now we'll go to the patient's room. Hello, Ms. Nagel. My name is Erica. I'm going to be your nurse today. We do have a medication called Zosyn ordered for you. This is to help clear up it's an antibiotic that's going to help clear up that infection in the incision site. Can you tell me your name and date of birth? And you would check this with the name tag or the ID band on the patient's arm. You would also, at this time, keep your medications with you and in front of you, and check it on the computer again. You'll make sure that you have the right medication, that you're giving it to the right patient, and that you're giving it via IV like it's ordered at the right time. Okay, so you educate your patient, you double check allergies. My patient's not wearing an allergy band, so I would just ask her, Ms. Nagel, do you have any allergies to any medications? She says no. Okay, so then we can begin setting up the medication to the hose or to the tubing, and then attaching it to our line here. Okay, I'll take this out. Okay, and this does have a cover here to protect this from being contaminated. You want to roll this down. Okay. Open these. Okay. You also want to put your name and initials on this line to ensure that so others know when this line was placed, and it's not old, or it is good to use, because sometimes the patients won't know. Okay, this will connect here. You want to be sure not to touch this area I haven't washed my hands after walking into the patient's room, and I do have on gloves, so I'm not contaminating the medication or it's not touching my skin. All right. And then you want to squeeze the chamber here, and you will fill it about halfway. Okay, and when you hang this medication, you do want to hang it higher. Can you see the bags? You want to hang it higher than your primary line here to ensure adequate flow. Okay, so I don't have a place to hang it here. Let's see. I don't want to pull down my chandelier, so I'm just going to set it here, but this would go up here. Okay, and you, like I said, you want to fill your chamber, and you also want to have this run through the line to ensure that there's no bubbles in the line. Okay, and then I will lock it so it doesn't leak everywhere when I go to connect it to the patient. Okay, this doesn't have an antimicrobial cap on it. So I would get a alcohol swab, and I would clean this for approximately 30 seconds before attaching this here. Okay. And before I get this running, actually before I even hook up the line, I would check my IV. I would make sure that this is a good line to even have any of this going to. Make sure it's not red, it's not infiltrated. And that the patient doesn't have any pain. I would set this to go in to the pump, into the mini pump, and I would set my secondary line at 4 drops per minute. If you are doing it to gravity, you would have to count, and that's about 15. Sorry. You would just have to count and ensure that the amount of drops dropping is what is ordered. Okay, so after the medication is in, the patient is doing fine, you would then chart the medication, where the IV is, what time you gave the medication, and this gives you time to sit with your patient and make sure that the patient's not having a reaction, at least for the first 15 minutes. You would also come in and check on the patient regularly. So my patient is doing fine, so I would chart that and then come follow up with the patient in just a few minutes to make sure that she is doing okay.